Contraceptives and contraception, it's one of the most important topic in your life. In the contemporary society where we find ourselves today, it's very important to know your limits. It's very important to plan ahead. It's very important to be on the same page with your partner. It's no longer ideal to have all the kids in the world when you can't take good care of them. It's no longer ideal to be competitive, to want to please everybody, please your mom, please your dad, please the community. But what's good is to know exactly the number of kids you want to have. And subsequently, when you've had the number of kids you want, what can you do to still enjoy your sexual health and still make sure you don't have kids, you don't have unplanned pregnancy? Because guess what? Not all pregnancies are planned. Some pregnancies are unplanned. And if you plan your pregnancy very well, you have a better outcome. Pregnancy, it's a very delicate process. So you want to start on time to know the number of kids you want to have, to know how to space your kids. And what better information do you have than the knowledge of contraception, than the knowledge of 15 plus different types of contraceptives you can use? So many contraceptives are not user-friendly. Some are. The ones that might work for you might not work for the other person. So for every woman in their reproductive life, it's expected you have a good knowledge of contraception up to the age of menopause. Remember, menopause can range from 45 to 50 depending on your gene makeup. So it's expected you have a good knowledge of reliable, workable contraception before you hit your menopause. So what happens in menopause, it's simple. By the time you're in menopause, your hormones are no longer going to be viable, so you're no longer going to be having a ovulation, you're no longer going to be having your menstrual cycle. You will enter into a different phase of life. So women are like flowers. So think about morning, afternoon, and evening. So the morning time, it's when God gave birth to you. Then the afternoon time is your reproductive life, your prime life. Then once you hit your menopause, you start, like the evening time. For some people, that's the most important aspect of your life. So the expectation is the fact that you can still enjoy your marriage, you can still enjoy your relationship, you can still enjoy your sexual relationship, and at the same time, have exactly the number of kids you want to have. It's very important, especially in our contemporary society. Most people believe that once you marry, once you've got kids, everything about your sex life will go down. Guess what? That's wrong. Matter of fact, before you hit your menopause, you want to make sure you have a very good, enjoyable sexual life. The reason is simple. By the time you hit your menopause, your hormones will start dwindling. You will start having vaginal dryness, you start having hot flushes, you start having a whole lot of difficulties in your female reproductive organs. So prior to that period, if you don't have an enjoyable, good sexual life and high libido, it's going to be difficult for you. So you're just going to be so frustrated. And some women can also have depression. So it's very important you know exactly what works for you and you plan around this. So first of all, let's have a quick recap of all the types of contraceptives we mentioned today. So we've got the condoms, we've got the pills, we also have fertility awareness, we have withdrawal methods, we have the diaphragm, we have the patch, we have internal condoms, then we have spermicides, we have sponges, we have cervical cap, we have the ring, we have the implant, we have the shot, the Depo-Provera, then we have the IUDs, the intrauterine device, then we have emergency contraception, and finally, we have sterilization. So all the methods I mentioned are actually different types of contraceptives you can use. And my partner, Chudi, started with the methods you don't really have failure and you don't really have control over. Once you have them, It's going to work whether you forgot or not. The ones I'm going to talk about today are the ones that are dependent on you, that can fail if you don't use it properly. So that's how effective it can become if you don't have good knowledge of what you need to do. So, like I mentioned, the main essence of contraception is to do what? To prevent pregnancy. And I also said you're supposed to use it until menopause. Remember, a normal woman is classified as menopausal if she has not had period for 2 years, if she's aged under 50. But if you're above 50 and you've not had your period for 1 year, you're classified as being in menopause. There are different methods of contraception which I just mentioned, but generally there are two different methods of contraception for men: the condom and sterilization. And guess what? The other methods I've been mentioning are actually unique to only females. So you can imagine. So in this particular discussion, females are going to take the front seat. So like I mentioned, we're going to talk about methods that depend on your own ability to use it effectively. So for these methods, you have to have a good knowledge and practice of how that particular method works. For it to be effective, you have to use it and think about this method regularly or each time you're having sex. And it must be used accordingly for it to be effective. So let me repeat. For the methods I'm going to discuss, it's very important you know how it works. It's very important you practice using it every time you engage in sexual practices. The difference between the method I'm going to be talking about from what Chudi talked about is the fact that the ones Chudi talked about, once you do your sterilization, once you put your IUD, you're not supposed to freak out because it's already in your system. It's going to do its function whether you like it or not. But the methods I'm going to talk about are going to be dependent on your ability to use it properly and use it timely. The first topic we're going to talk about today is contraceptive vaginal ring. So you see, contraceptive vaginal ring actually has effectiveness of almost 99% if used according to instructions. So if you put it in statistics, less than one woman in 100 will get pregnant in a year if that person is on vaginal ring. So what's a vaginal ring? So this is a small flexible plastic ring you put in the vagina that releases two important hormones. The two hormones actually it releases are estrogen and progesterone. So estrogen and progesterone can be in synthetic form. When I mean synthetic form, I mean the artificial form, not the natural form. So the two important hormones in reproduction, it's estrogen and progesterone. So in our discussion, you can see that these two hormones actually play a role in almost all the contraceptive methods we're going to be talking about today. So contraceptive vaginal ring, it's a tiny plastic you put in your vaginal area, and the function is to release these two important hormones. These two important hormones will reorganize your menstrual cycle and make sure you're not going to become pregnant. So actually, how does the contraceptive ring work? It works by stopping you from ovulating. And how does it do this? It thickens the cervical mucus and it prevents the sperm from reaching the egg. So that's practically how this particular method works. And this particular method, at the end of the day, thins the womb and prevents fertilized egg from implanting. So let me repeat. So for pregnancy to occur, the egg must have union with the sperm. But if for any reason the cervical mucus is thickened, it's not going to help the sperm to reach the egg. So guess what? Fertilization is not going to occur. Also, if fertilization occurs, this particular combo will make it impossible for implantation to occur because it's going to make the womb lining to be thin. Normally, for you to become pregnant and have successful pregnancy, your womb lining is supposed to be thick, but this will make it to be thin. So it's not possible to become pregnant when you're on this. But guess what? You have to use this method effectively. So you have to pull that ring way prior to having sexual intercourse for it to function properly. So what are the advantages of using this particular method? The first advantage is the fact that you don't have to think about using this method every day once you put it correctly. It's not also affected by vomiting and diarrhea, because the issue is this. A couple of contraceptives, when you take them, when you swallow them through the gut, if you vomit, which some women are very good in, especially women that don't really like taking medications, when you vomit, you're practically going to affect the effectiveness of that contraceptive. But your vaginal ring is not going to affect the effectiveness. It's not going to be affected by vomiting and having diarrhea. So that's an advantage. Also, another advantage you want to think about is the fact that it makes your period to be more regular, more lighter, and less painful. This is actually a very good advantage, because guess what? Some women have what we call dysmenorrhea, very, very painful period. So some contraceptives like this one I mentioned is actually going to make your period to be lighter, more regular, and less painful. So these are the advantages of having vaginal ring in situ, and it's also very easy to insert and remove. And it also helps in women that have acne. Acne are very, very bad, excoriations, pimples in some women. So this particular method can actually help give you a better outlook if you have problems with acne. So what are the disadvantages of using a vaginal ring? Well, it's not suitable for women that are overweight, for women that are obese, and also for smokers over the age of 35. Let me repeat. If you're obese, if you're overweight, and you smoke, and you're 35 and above, you do not want to use this method. Why? Very simple. Estrogen is a good hormone. But estrogen as a hormone can predispose you to some other very deadly outcome if you combine it with some other lifestyle. So the estrogen component of this particular contraceptive can actually predispose you to a lot of things. So one of the disadvantages is the fact that you're not supposed to use it if you're obese, if you're a smoker, and if you're 35 years and above. It also has some mini side effects of blood clot, breast and cervical cancer when you use this particular one. It can also lead to some temporal side effects like, vaginal discharge, headaches, breast tenderness, and mood changes. It can also lead to some, skin irritations. Also, when women use this, they feel uncomfortable inserting and removing it. So these are a few limitations. And the ring is actually used for 3 weeks out of the 4 weeks. Also, some medications can affect its effectiveness, and some women can have what we call breakthrough spotting. So this is in a nutshell what vaginal ring is all about. So this second method is actually a very popular method for everyone out here. So don't be shy. I'm sure a couple of you must have used the pills, the combined oral contraceptive pills. So these are the popular pills, some women pop and hopefully get protected from becoming pregnant. So this is called combined oral contraceptive pills. It's very popular. And if used effectively, it's also about 99%, effective when used properly. So it's a very popular method. It contains the two hormones I mentioned already. It contains estrogen and progestogens. And these act exactly the same way the other one works. It acts by stopping you from ovulating. It also thickens the cervical mucus by preventing the sperm from reaching the egg and thinning the lining of the uterus. And in course of doing that, it's going to prevent the fertilized egg from implanting. So please, if you're listening to me and you're using pills, it's something you want to take note of. If you're using pills, there are some conditions, there are some medical conditions, there are some lifestyle you don't want to indulge in. One of them is smoking. Also, you have to be conversant with other things you eat that might contain artificial extra hormones. So please, you don't have any business smoking when you're using pills. And also, if you have family history of cancers, because the estrogen component of the pills can predispose you to some cancers. So please be careful. And please, if you're on pills, make sure you follow them religiously. And I'm going to come to the limitations of using pills, but pills actually work exactly the way the other one works. So when you're using pills, remember it contains estrogen and progestogens, which is an artificial progesterone. So please be very mindful when you're using the pills because it's very common out there. So what are the advantages of using the pills? It actually also makes your period to be regular, to be lighter and less painful in some women. A very good advantage of using the pills is the fact that it reduces your risk of having cancer of the ovaries, of the womb, and colon cancer. So guess what? Life sometimes can be complex. So the same contraceptives that can predispose you to some conditions is actually conferring protection from getting some specific cancers, the ovary, the womb, and colon cancer. Does it mean you have to go home and start popping the pills so it's going to prevent you from having this? No. It doesn't mean you have to sit down and be gulping it so that it will prevent you from having cancer. Don't do that. But if that's the option you opted for, it's going to confer this protection to you. So you have to be mindful. It's very suitable for healthy non-smokers up to the age of 50. So you can see one of the caveats for using pills. You're not supposed to be a smoker. If you're a smoker, it's going to potentiate your risk factors towards having some untoward outcomes. So you need to be very careful when you're using the pills. Also, when you stop using the pills, your fertility will bounce back almost immediately. So the problems we have with a couple of contraceptives is the fact that some women will have artificial period of infertility once you stop using a particular method. It stays in your body, so you need to wash it off before it can bring your fertility back to normal. But for pills, once you stop using pills, your fertility comes back and you can take it anytime you want. So what are the disadvantages of taking pills? It's also not suitable for women that are overweight, women that are obese, and smokers. It also can have some many side effects like blood clot, breast tenderness, and it can also potentiate cervical cancer. It can also give you some temporal side effects like headache, like feeling like vomiting, and it can change your mood and also lead to breast heaviness. What are the limitations from using pills? One of the biggest limitations is the fact that we are all very busy people. We don't like having regulations and rules. If you're in ATG, you can attest to the fact that members break the rules even when it's staring at them. People don't read posts. They just come in, they want to ask their questions and go. So compliance is a problem with using the pills. So most people will miss taking their pills, and once you miss that, it's going to affect the effectiveness of using the pill subsequently. So that's a big limitation. So the ability to miss your pill when you're not supposed to miss it, it's one of the limitations. And also some medications you're taking can affect the effectiveness. You can also have breakthrough spotting, which is common in the first few months. The third method we'll talk about today is called POP, progestogen only pills. And this method is also very effective, about 99% if used accordingly, and you can have just less than one woman in 100 getting pregnant in 1 year. It also contains just one hormone. Okay, so let's quickly compare the progestogen only pills to the combined oral contraceptive pills. The progestogen only pills contains only progestogens, so it doesn't contain estrogen. Remember, estrogen is the difference between this and the other one. So this one contains just one hormone. So we're going to talk about things that actually make this one stand out, and you'll be interested about that. So the very first advantage of having this is the fact that it can be used by women who cannot use estrogen. So if for any reasons you have estrogen dependent conditions, because some conditions can actually prey on the estrogen in your body and cause some problems. There are some breast cancers that depend on estrogens, that once you have artificial estrogen in your body, they can hop on it and make your condition worse. So if you happen to be in the category of people that can use estrogen, progestogen only pills, it's the best method to use. So take note of all the key similarities, all the key differences between the different types of contraceptives. That's going to be the tiebreaker. That's what you're going to take to your provider. That's what you're going to discuss with your partner. And you say, honey, guess what? We're not going to use this because of this. So in this condition, you're not going to use combined oral contraceptive pills. If you have any condition that predisposes you to problems with estrogen, we'd rather use progestogen only pills. Okay? So it can also be used if you're breastfeeding. You can also use this if you're a smoker. Oh, here we go. But guess what? The fact you can use this if you're a smoker doesn't mean you have to use it. Doesn't mean you have to you don't go and be smoking all the cigarettes in the world. No, cigarette is still gonna kill you. But if you happen to be a smoker, or if you happen to be contending with stopping smoking, this is the method you want to use. So everything bad about oral contraceptive pills, it's good in POP. So consider using that. What are the disadvantages of using progestogen only pill? It can disrupt your whole menstrual cycle. So it can change your period from being regular to irregular. It can actually stop your period entirely. It can make it lighter, or it can make it more frequent. It can also cause some mini side effects like acne, breast tenderness, weight changes, and headaches. It can also lead to ovarian cysts. So you can see specifically that this particular option, in as much as it has some good qualities, also has some side effects you have to be on the lookout for. So when you go home, please make reference to the file we shared with you before making up your mind on the choice. And at the end of our presentation, I want us to decide on the best method that will work for us. So you think, and I think Dr. Chudi shared a couple of polls out there for you to decide the method that will work better for you. Okay, so what are the limitations for using this? It needs to be taken exactly at the same time of the year. So there's a possibility for you not to be compliant. It's also not effective if you take it over 3 hours late. Also, some medications in the body, and if you vomit or if you have diarrhea, it can affect it. Okay, here we go. Guess what the next method is all about? So this is the method most people think they know better how to use it. But guess what? Most times we don't know. So the next method I'm going to talk about is condoms. The male condoms. After male condoms, we're going to talk about the female condoms. So the condom is actually a synthetic latex, rubber, or polyurethane, which is plastic. You're actually supposed to use the condoms way ahead on time. You're supposed to put it in an erect penis, not a flaccid penis, not a fallen hero. You're supposed to put it in an erect soldier. So this is the most common method of contraceptives out there. But guess what? This is also the method most people think they know, but they don't know. So we've had a couple of people that will come in and tell you, Doc, I don't know how I became pregnant. My partner used condoms, so how come I became pregnant? I don't know if it's immaculate conception. Maybe God put in the baby in there. But guess what? God did not come down to put that baby in your womb. You guys didn't use it correctly. So there are basic things you're supposed to know about using the male condom. First, the condom must be used on an erect penis. you have to put the condom correctly. You have to be very fast in reversing it and putting it correctly. The condom has to go way, way up to the root of the penis. If you also have hairs as the guy, you have to be careful when you're putting in the condoms. Because of putting condoms, those hairs can cause some tear and some holes in the condom, and you will think you're protected. And guess what? You're out there playing your game, and you will go home thinking you're safe. And your girl will call you and say, hey guys, see what's going on. And you guys will start quarreling. You will think your girl slept with another guy. Meanwhile, you're the father. So it's very important you know how to use the condoms. It's also important to know that condoms have sizes. It's also important to know the type that works better for you. In the developed world these days, we have so many types of condoms. So many, it's freely available, but you have to be conversant on the best way to use condoms. And let me say this. If you engage in foreplay and you play around the vaginal area with the penis, and subsequently your girl will wake up suddenly and say, oh, let's use condom. But you guys have already played around the vagina, and you've already had some emissions of pre-ejaculation that had contact with the vaginal area, and your man will now wear the condom, and you guys will have fun, and you think you're protected. Guess what? You're not protected. Any contact of the penis within the vaginal area prior to having sexual intercourse can still lead to pregnancy, can still predispose you to sexually transmitted diseases. So I'm laying more emphasis on this method because that's the better and the more useful method for so many people. The other methods we talked about, depending on the availability in your location, you might not readily have it. But please know how to use the condoms. Also, some condoms are very sensitive to using lubrications. Some condoms come with spermicide inside. Some condoms you can use with the lubrication. So if you use lubrication, it can actually lead to some problems. Also, be very conversant with the fact that in course of using condoms, you can have some accidents. So if you don't put the condom properly, the condom can get missing inside the lady's vagina. You can actually completely sleep. And for some men, once they are in. They don't want to come out. So some will not even know that the condom is no longer there. So they push it further into the vagina of the lady. So when I was in Nigeria in Air Force Hospital, I had a patient that came in and, she was having very purulent vaginal discharge. And she could have sworn that everything was okay with her. When we examined her vagina, we discovered that she had a lost condom inside the vagina. And we kept wondering, how can a man wear a condom in case of having sexual intercourse with a girl and you forgot that the condom you wore didn't come out with you? So we did a speculum exam and we saw the condom inside the woman's body formed a focus for so many infections that could have caused so many problems for the lady. She was lucky. We removed the condom and we placed her on some antibiotics. And she was okay. So please don't think you know when you don't know. The best thing I expect you to do, and remember, ladies, condom is not only meant for the guys to know how to wear them. You as a lady should actually play a role in making sure your partner wears a condom properly before your partner goes in there. You have a role to play. This is 2017. Gone are the days where you sit back and you lay all the blames on somebody. You play a role in your health, especially in reproductive health. One good thing about choices is the fact that you can decide on the method that will work better for you as a lady. Gone are the days where you leave all the decisions for the guys to take. Start taking charge of your own health. Very, very important. Okay? So the condoms, when used effectively, it's about 98% effective. And like I mentioned, it's made of latex. It prevents the sperm from having access to the vagina. It frees, it's free, it's easily available. It has no major side effects. Okay? What are the disadvantages? I've already mentioned that it can slip off. The man needs to withdraw the erect penis after ejaculation. Once the penis falls, the condom is not going to be useful again. So you have to remove the erect penis immediately after you've ejaculated. You have to also, the limitations, you have to put the condom on the penis way ahead on time. And some condoms, the oil-based product can damage the condoms. And you have to remember it's available in different sizes. Okay? So now let's talk about the female condoms. So very few of us actually know about female condoms. I don't know if you've seen the female condom itself. So the female condom, and another thing I wanted to mention, one very, very, very solid advantage of using the condom. The condom is the only reliable method that will prevent you from having sexually transmitted diseases if you use it properly. The condoms are the only methods. So in this period, I'm talking about condoms because it's going to be the male. The male condom is actually more effective in preventing sexually transmitted disease when you compare it with the female condom. So it prevents you from having this. The female condom is also effective, but you cannot compare the effectiveness with the male condom. So the condom is the only option that can help you prevent you from having some diseases. All the other options I mentioned, once you have contact with the vagina, you have a probability of picking an infection. So let's talk about the female condoms. So the female condom is actually about 95% effective in initiating contraception. So about 5 women in 100 will get pregnant in a year. It's actually made of thin polyurethane material compared to the condom. And either it's the fact that it sits loosely and lines the whole vagina up to the inside and covers the area just the outside. And it also works by preventing the sperm from entering the vagina. What are the advantages of the female condom? You can actually put it way ahead on time before sex. The reason is simple. In comparison to the male condoms, your vagina doesn't need to charge and be erect. So you can put your female condom and go to market and come back and cook and do all those stuff. Then you go back and have fun. So that's a big advantage. So in some men, in the heat of the moment, they won't even remember the condoms. So that's the advantage of female condoms. So you can put it way ahead on time. Okay? The next advantage is the fact that it can help prevent sexually transmitted disease, which I've already mentioned. And you can also use oil-based products with female condoms as against the male condoms. It doesn't really have any, side effects, but you need to know exactly how to use the female condom. That's one of the limitations. So you need to make sure the man's penis actually, this is a very, very important point you have to know. If you're using the female condom, you have to make sure that man's penis, it's not going beneath or beside the female condom and pushing the whole condom inside your vagina. So the condom has to be properly used. So if the man is going in, the man has to go in the space. So one of the problems is the fact that if you're not doing it properly, you can actually push the whole female condom inside the vagina and you will think you are actually doing the right thing. We're talking about methods that it's dependent on your ability to use the methods effectively and according to instructions. And we've been talking about different methods. So we're still on female condoms. So you can also have a problem of pushing the condom inside the vagina, which I've already mentioned. So you have to use a new condom each time you're having sex. You don't have to go and, be economical with condoms, both male and female condom. Once you've used a condom, you discard a condom. You have to use a fresh condom during any sexual act. It's sold online and some pharmaceutical shops can have it. The next method we'll talk about is the diaphragm or the caps with spermicides. The next method we'll talk about is the what? The diaphragm or caps with spermicide. So the diaphragm is like a cup. It's like a cup. So this cup actually has 92 to 96% effectiveness when used with spermicides. So spermicides are actually substances that kill the sperm. So anywhere you see side, it's killing. So spermicides are substances you can put inside the diaphragm that will help kill the sperm. So between 4 and 8 women in 100 will get pregnant with this method. So it's actually made of flexible latex or silicone. So you put some spermicide inside and you put it inside the vagina to cover the cervix. So let me just explain. The diaphragm, it's supposed to protect you from becoming pregnant. How? You push it inside up to the cervix and it covers the cervix and prevents the sperm from going in to make you pregnant. So most times it comes in combo with the spermicides, which kills the sperm already deposited in the diaphragm. So when both of them work hand in hand, they work towards achieving contraception. So what are the advantages of using the diaphragm? You can put it anytime before sex, just like the female condom. You can use it whenever you want to have sex, and it doesn't really have any serious side effect. So what are the disadvantages? You have to put extra spermicide anytime you want to have sex again. So let me explain. So you put in the diaphragm, right? It goes way into the cervix, right? And you guys just had one round of sex, right? And you think you're protected, you remove the diaphragm. You have to put another spermicide to go again. And I can tell you this, most sexual intercourses and stuff are not planned. Most people don't even have time to be doing all those remove and put. So you see why the methods today discussed, it's way better than the method I'm discussing. You want to sleep with your 2 eyes closed when you're having sex. You don't want to be thinking and be having dreams of how you had triplets in your head. So one of the disadvantages of using the diaphragm is the fact that for any sexual act, you still have to go back to the base and reboot. And I'm telling you this for real. Most people don't have time for, all those back and forth. Once they're in, they're in. Okay? Then some people are very sensitive to the spermicide. And for some people, it takes time for you to know how to use the diaphragm effectively. The limitations. You need to know exactly the correct size of the diaphragm to use it effectively. And you also have to know that there are a couple of conditions you will have that will affect the ability for the diaphragm to function properly. So if you've had babies, if you've had miscarriages, and if you've had abortion, it can affect the sizes of the diaphragm you want to use subsequently. Also, you need to make sure you leave the diaphragm. This is a very, 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 very important point. You need to make sure you leave the diaphragm inside your body about 6 hours after having sex. So think about that. You have to leave it inside for it to be fully effective. The next method we'll talk about is the natural family planning, also called the fertility awareness method. So this is the method you guys are all conversant with, right? The natural planning method. This is actually the one we've been preaching. So how does this method work? It works by knowing your body fully well. So when we ask you what's your menstrual cycle, are you 27, 28, 29, 30 days? We're asking you because we want to know your cycle. So I expect each and every one of us here to know their cycle, to know when you ovulate, to know when you're fertile, to know when you're not fertile. When you know, you can walk around the period you're supposed to engage and the period you're not supposed to engage. So that's pretty much what fertility awareness method is all about. And this method is actually not too reliable because there are a lot of things that can change. But if used accordingly, up to 99% of people will have good results. So about 1 woman in 100 will get pregnant in a year if this method is used effectively. So the idea is to know your fertile and infertile period of the menstrual cycle by doing nothing differently. So you have to know when you ovulate, you have to know your fertile window, you have to know your infertile window, you have to know exactly the signs of ovulation, which we've taught so many times. So what are the advantages of this method? It has pretty much no physical side effects. It gives the woman a greater awareness of her body. You can also use it to plan for pregnancy. So this method is very good. It gives you an ability to study your body and know exactly how your body works. Very important. So if you're listening to me and you don't know how your body works, please take time and study your cycle. Your cycle can fluctuate. Your cycle can be normal. Your cycle can be abnormal. It can move from 30 to 31, 32, 28. It can be all over the place. What you need to do is to keep a diary to know the changes. Some cycles are regularly irregular. Some are irregularly irregular. So you have to know exactly how it works. You have to know the signs of ovulation. You have to know when to engage. You have to know what flips. You have to know the conditions that can help boost your fertility and the conditions that cannot help boost your fertility. When you know all this, it's very important you apply them correctly. So the fertility awareness method is pretty much what you have to be conversant with. What are the disadvantages of using the fertility method? You need to avoid sex or use condom at fertile times of the cycle. So sometimes you might think you're fertile, whereas you're not. So you have to be very, very, very mindful when you engage. It also takes 3 to 6 menstrual cycle for some women to know effectively what their menstrual cycle is. You also have to keep records. There are a couple of devices out there that can help tell you when you're fertile. So if you happen to have those devices, you can use them. It can help you know exactly when you are fertile. The next method we'll talk about is the spermicides. So I already mentioned about the spermicides anyway, in line with using it with the diaphragm. But this time around, we'll talk about the spermicide itself. So the spermicides, like I mentioned, are substances that kills the sperm. So anywhere you see side in medical practice, it's killing. Okay? Anywhere you see side is killing. So this particular method it's simply based on using substances that will kill the sperm. If the sperm is released, it goes to the sperm and kills the sperm fast. So the sperm will not be effective. So it comes in forms of creams, foam, gels, suppositories, and it contains chemical that stops the sperm from moving. That's pretty much what it does. Remember, the woman is supposed to use this product, so you insert it deep into the vagina, thereby keeping the sperm from getting through the cervix and into your womb. There are a couple of facts you have to know about spermicides. It's better used in combination with other methods. So when you use the spermicide alone, the effectiveness will not be perfect. But when you use it in combo with the diaphragm, in combo with the condoms, you increase the effectiveness. Also, be very sure you wouldn't mind getting pregnant because this particular method can fail. It's not reliable. You don't necessarily need prescription to get, the spermicide. You can walk up to over the counter and you can get it. Some people also have allergies to some spermicides, so be very mindful what works for you. Also, be very, very, very sure your partner is not HIV positive when you're using this method, because pretty much it's not going to protect you from having any sexually transmitted disease. So the chemicals used in spermicide can change the sensitivity of your skin down there and makes it more possible for you to be prone to picking up HIV. Very, very, very important. So what are the positive side effects of the spermicides? It's very easy to use. It's convenient to get a hold of. You can insert it, during foreplay. It doesn't affect your hormones. You don't need prescription. It can be used while you're breastfeeding. So what are the side effects, the negative side effects? It can actually be messy. It can leak out of the vagina. It can irritate your vagina and your partner's penis. And some people are very allergic to it. So you can see there are a couple of things that are positive for the spermicide, but there are also a couple of things that are negative. for the spermicides. So the watchword is what works for me. So there is no one size fit all contraception out there. So what works for KK and not work for K. But the good news is, you know what was better for you. And I also want to advise to combine different methods of contraception. So you can see, for the spermicides to be effective, you have to combine it with the diaphragm. You have to combine it with the condoms. So if you try any method and you receive failures, when you go to see your provider, discuss about other alternatives. But you can see that the spermicide alone can actually cause some problems. Some women have very sensitive vaginal area, so it can lead to irritations. And also, if you have a partner that you don't know the sexual history and you don't know if it's HIV positive, not just HIV positive, any sexually transmitted infections, you are prone to picking that infection, because this spermicide can make you to be more prone, more sensitive to having the infections. Okay, so the next one we'll talk about is the method that some people are still using, but guess what? It's not functional. You don't even want to talk about it as a method. So it's called coitus interruptus. Coitus interruptus. Simply called withdrawal method. And guess what? There are a couple of people we engage today. They tell you, oh, doc, you see all these methods you guys are talking about. You guys don't even know what they're talking about. This is the one that works for me. Oh. This is the one that works for me and my husband. So let me explain. Do you know how coitus interruptus feels like? Do you know how it feels like? This is actually the worst method to use. It's least reliable and it has a very, very, very high failure rate. But it's the oldest form of birth control. And there is nothing much to explain actually. It's simply, a case of, in the heat of the moment, just before the guy arrives, he applies brake and stops riding the car abruptly. And that's where the question comes. If your partner is listening to me, how many men can apply brakes properly in the heat of the moment? Let's be real. Let's stop pretending. The act of sex is under the control of the higher centers in the brain. There's a point of no return you will reach. You won't even remember where your brake is. This method, it's not functional. It's not reliable. We will not advise it for anybody. Most men, if you don't have erectile dysfunction and you don't have anything that affects your fertility, that affects your functionality, most men will not remember to apply their brakes. Believe me. Most men will opt to have that accident and take the car to the car shop. That's as simple as that. And some women are hyperfertile. Some women can become pregnant even without penetrative sex. So the moment you're having contact with the vagina, you are already predisposing yourself to becoming pregnant. So you don't necessarily need to go in to become pregnant. So coitus interruptus, it's the worst form of method of contraception. But some people tell you, oh, it works for me. And let me tell you, in my culture, they said that the same place you go and go back home every day, one day you will go there and you will get stuck there. If you don't want to have battalion, please stop using coitus interruptus. This is 2017. It's not feasible. It's not functional. You don't want to use it. It's not the best method out there. I don't expect every woman to go and lie down like, a product, and the man will climb you and pour stuff and go out and blame you. You didn't give me a lady, you gave me a boy. No. You have to step up. Communicate. If you're not feeling it, hey, Guy, stop. I'm not feeling it. This is the way I want it. This is a partnership. This is not slavery. If you want to prevent pregnancy, know the method that works better for you. If your partner is insisting on coitus interruptus, tell your partner, guy, you know what? I'm done. See you at the doctor's office. Because guess what? It's not going to happen. You're going to have babies. So if you've had so many babies and you want to stop, please use an effective method of contraception. Very, very, very important. Okay? Remember, the key in contraception is to know what works for you. You've got to do the right thing every single time regarding withdrawal method. So how many guys do you know out there that actually has this type of control? And like I mentioned, even if you correctly withdraw the penis from the vagina before ejaculation, there's already contact there. You've already predisposed yourself. So the failure rate for withdrawal is about 22%. That's very high. So if you don't mind becoming pregnant, this is actually the method you can use. Okay? But for successful birth control outcome, you have to use this in line with other methods. But the biggest advantage, everything we've discussed so far has advantages and disadvantages, right? The biggest advantage of withdrawal method is the fact that it's what? It's cheap. It's cheap, it's free. You don't need to use any hormones. But guess what? It's the method that can easily make you to become a father, a mother, even when you don't want to be. Okay, so thank you so much for giving us this opportunity to share our knowledge. The ability to succeed in contraception is based on effectiveness, is based on compliance. So you want to do something that you don't want to be, thinking about it once you've done it. So go put your IUCD, take your injectables, take your implant, sterilize if you've completed your family. But please express yourself. Please participate. Please be proactive. Please discuss with your partner. Gone are the days when you just go in there and you're just a passenger in your own life. That's not proper. So feel free to message us, ask either any of us any questions regarding your choices, any difficulties. If you haven't discussed contraceptives with your partner, this is an opportunity. Open your PDF file, discuss it with your partner. Try some options. If it doesn't work, try another one, but do something for yourself.